Dr. Corona, for joining me on my first episode of the Wellness and Growth podcast.
Amazing. It's the first one. I'm really, really honored to be here then.
Yes, yes. Well, you're the inspiration really because um, your complete wellness women's checkup. I love that. I love an all-in-one package, and I loved that you could come and just get checked out and to make sure that you're healthy. And it just kind of dawned on me, like, why don't we do this as women? Why don't we get like a regular annual checkup to make sure that
Yeah,
we're okay, right?
I know,
Uh,
right?
and then there are like so many solutions out there to help you, especially after like childbirth and stuff like incontinence and that kind of thing, right? That we don't know about. We actually don't know that there are solutions out there. We don't have to suffer alone. So I really wanted to start this podcast as an educational type of
Yeah.
media for women 35 plus. I'm going to be genderless here, if that's word. And yeah. So let me read a little bit. I have your bio here, so let me read a little bit about that. So Dr. Corona, you're a specialist in obstetrics and gynecology. She has practiced her skills in Italy, Belgium, and Barbados. She is also a fully registered OB/GYN specialist in the UK. During her time in Belgium, Dr. Corona worked as a fellow in urogynecology and endoscopic pelvic surgery. So hopefully these words.
That's correct. Very good, very good.
She was also appointed as a consultant in fertility and as teacher and supervisor of medical students. In 2011, she worked as a consultant at the Reproductive Medicine Center at the Free University of Brussels. For 7 years, Dr. Corona worked as a consultant fertility specialist at the Barbados Fertility Center. And that's when I first heard about you, actually, offering fertility treatments and other services as on-call fertility, andrology, micro TESE, and minimal TESA,
Yes.
and minimal invasive reproductive surgery. She has always been guided by her passion for medicine and women's health, yay, and has assisted for years women struggling with their fertility. In the past years, Dr. Corona's attention has been directed to identify and fill gaps in women's healthcare and realized there was a tremendous lack in management of midlife women, which is yes. This is what this podcast is about. So yes. So I'm just going to finish this part here. She became a member of the North American Menopause Society, and in October of 2021, a certified menopause practitioner, the first in Barbados. And the reason I'm going to stop there is because I want to hear from you about yourself and your journey into the health and wellness. And you said, I'm going to have to keep that word in my head now, midlife women.
And that's the word. That's the word. Midlife women, because that's midlife. We are living up to 90 years old now, or even more, hopefully. And that means that we are spending almost half of our life actually in the transition and the post-menopause years.
Right.
We've never seen this as so much as now, because we never lived so long. It's like a little bit a startup life. So we are seeing the effect of this, and we are realizing how important is longevity, but how important is quality of life. We want to live longer, but we want to live well.
Yeah.
So I think the focus in medicine is changing. At least it's changing for me, and that was one of the trigger that definitely pushed me in this project. The idea is to see patients, to see women when they are healthy, not when they are sick.
Yeah.
So do kind of preventive medicine. So give them the tools, the education that will permit them to live longer and healthy later on.
Yeah.
So it's it was a dream and now it's a reality, to give this safe, caring space where you can express yourself and you don't need to feel guilty, neither if you want to look beautiful or you want to feel beautiful or you want to just take care of your normal gynae stuff. So it's a place you come and women can find a little bit of everything.
Yes.
There is a community, there is support, there are lots of solutions. It's a very modern way to do medicine. So we have brought in lots of technology as well. And there is lots of thinking behind and lots of knowledge and lots of evidence-based medicine. So
Yeah.
this was a little bit the idea. What I was noticing is that yeah, after the fertility years, there was absolutely nothing, or really, really minimal. And even myself, until probably 10 years ago, I didn't know much about menopause and midlife women and how the body change reinforced, because we actually never really studied at the university. We did a couple of hours about that, and everything else is about surgery, is about obstetric, but what after?
Yes.
And that's why we are here, because the after, it's 40, 45 years.
Yeah.
It's not just blinking your life.
No, no, no. I appreciate that. And it's true because after I gave birth, um, I felt like then what next? What happens? Like like your OBGYN is like, okay, well, we're done. And you
Yeah,
probably go
we're
for like
done.
your checkup every year and that kind of thing. But yeah, in terms of support and how your body is, especially after giving birth, I do feel like that was lacking. I really do. Because you start to suffer, I want to suffer, but you go through so many things um after giving birth that you don't know, right? That that other people are going through the same thing and that you don't have to just like take it. Like there are
No,
solutions
that's
out
the
there for
point.
you.
Yeah,
Yeah,
women are very resilient and we are kind of used to go through things, but we don't necessarily need some things that are common. It doesn't mean they are normal, or it doesn't
right.
mean, I don't like the word normal, but it doesn't mean you have to suffer through it. There
Yeah.
is not there is not a medal or a prize if you suffer more in life.
Yeah. Yeah. Yeah.
At the end of the day, you need to be happy, you need to be healthy, and you need to take care of yourself.
Agreed.
And there are so many solutions out there that can make your life easier and healthier and happier at the end. Because if you're healthy, you are also happy.
Yes.
So it's all a matter of quality, really, all a matter of quality.
Okay. Well, that moves on to leads me to the next question. What unique approach or practices is your clinic offer that sets it apart in the health and wellness space?
Yeah, I think taking care of this age group, that's the first thing. As I said before, putting together traditional medicine and modern medicine,
Mhm.
preventive and technology. We offer treatment like the pelvic floor for incontinence or sexual health, non-invasive, that no one else offers. We have the vaginal laser that no one else offers. And obviously, it's not the only solution, but it's one of the tools available. We offer in-house hysteroscopies that, yes, there are other centers they can do as well, but not in the same setting
Right.
where you do everything else. And we do that aesthetic medicine as well, and even the aesthetic is done. I believe in a little bit of a different way
Mhm.
because it's more complementing than anything else. We don't do major things that are going to
Right.
change your face or your body. We really want to enhance the
Mhm.
natural beauty. So we push a lot on healthy skin. So treatment that stimulate the collagen, the elastin, that basically help you to maintain
Yeah.
your beauty and your health long as possible. And it's part of when we talk about an human being, it's everything. It's not just one thing. So
Right.
I think the holistic approach is what we offer mostly. And I love my patient. They come here and they say, "Oh my God, I can come here, see you as my gynecologist, and then I go on the other room and I can have, I don't know, I can have a facial or I can have a treatment, and I feel complete because I want to be good inside and out."
Yeah.
And as
That's
women,
wonderful.
we know that's very important for
Yes.
your esteem as well.
Yes.
So it's not something to be ashamed of. So that's also something I want to take out that stigma a little bit, that you need to be ashamed if you want to feel beautiful, or if you want to treat your sexual health and you want to have a wonderful sexual relation with your partner. Why not? There is nothing wrong with that. It's
Nothing.
natural.
Yep.
So
Completely
yeah,
agree.
I think combining all these things is what make us a little bit special.
Yes, yes. And I could vouch for that for sure. And so for women entering or in their 40s, what specific health and wellness concerns should they be more aware of? And then how can your clinic help with these
Yeah,
issues?
that's a good question. I think that it's a turning point in a woman life.
Hmm.
And lots of people think, oh, diabetes type 2, hypertension, osteoporosis, dementia, they are all disease of all people. But actually, those diseases, the seed, are placed now when you are in your 40s. So that's really the age when you need to start looking at preventing those things in the
Right,
future.
right.
So that's the moment where I recommend that you have, you start having your checkups, that you have a kind of a baseline, you know, where you are with your cholesterol, where you are with your sugars, where you are with your hormones, with your bones, so that you can start making those lifestyle changes that will permit you to maintain that status as long as possible, and you can prevent the disease, because majority of those disease, the chronic non-communicable disease, are
Hmm.
preventable.
Right,
And if you start looking to it early, you can reverse the early stages. So
right.
it's really, really important to start looking at them in your 40s
Hmm.
or in your 50s at least, not too late. When you come to see
Okay.
me, we have a discussion. I will explain why it's important. I can give advice on lifestyle changes. And I know we are busy women,
Yeah,
but in many cases, we also find excuses, and it's not smart, because if you don't take care of yourself, you will pay later on. So it's really, really important we start prioritizing our health. So
yeah.
that would be my message.
Yeah. And you know what else too? I think we also say, well, that's small, we don't, oh, we can handle that, that's not important enough for me to get checked out. We take on a lot of that burden ourselves, and don't see it as, maybe like an important thing that I could get help with.
Yes, you
So
can get help, and you probably can avoid of that little problem to become a big problem.
exactly, exactly. Are there any preventative measures then that you recommend for women in this age group? Now I'm gonna say that for us in this age group.
Yes,
It's
for us. Yes, start looking at your diet,
right.
uh, because it kind of naturally, with the estrogen going down, the sugar metabolism change a little bit. Women become a little bit more insulin resistant. Obviously, it's subjective; not everyone will, but in most of the case, so it will become it's more difficult to get rid of the extra pounds, and then they start to accumulate, and if they start to accumulate in the visceral area, then will give problems later on. So this start looking at your diet seriously. Ask advice, journal, what am I eating? Is this healthy enough? Maybe I can start to substitute some things. So that's one. Decrease the intake of alcohol. That's also important. Alcohol is a known cancerogenic substance for at least 7 cancers, okay,
Oh, wow.
including breast cancer. Okay, drinking a glass of wine per day it increases your risk of cancer more than HRT or any other hormones you can take. And women don't know that, but people don't know that. So
I did not know that.
and in the Caribbean, culturally, people drink a little bit more because we're very festive, I guess. But important to be mindful of that, because you are putting in your body something that is actually increasing your risk of cancer and your risk of other disease.
Oh, wow.
So at least don't drink during the week. Just do it socially in the weekend or when you go out. Really start thinking about that.
Okay.
Try to exercise. Exercising is really important. If you can exercise 2.5 hours in a week, just moderate exercise, 2.5 hours, you almost halve the risk of breast cancer. That is one of the most common cancer in women. You decrease by 15-30% risk of cardiovascular disease. You live longer, you live healthier, you decrease your risk of osteoporosis and fracture in the future. So put things in place that will permit you to exercise. If you don't have much time, even just when you are brushing your teeth, bring your leg up and balance yourself, okay? And alternate left and right, okay? Buy a weight vest that you can wear in the house, even when you are cleaning the house, when you are walking the dog, or even at the office. Why not? Take the staircase instead of the elevator. Little things during the day that can make a big difference. And I think one of the main mistakes and what brings a lot of frustration is that I see many times my patients say, okay, well, I need to change from Monday, I'm going to be on a diet, I'm going to go to the gym 4 times a week, and we have all these huge goals. They are not achievable. And then you realize that you do it the first week and you cannot continue.
Can't maintain it.
Work. And then it's frustrating, and then you feel like it's a failure, and you say, well, okay, and you give up. So what can you do? Get in mind, so try to find a goal that is actually achievable. So 4 times a week to the gym, honestly, it's very difficult for anyone unless you are a really a pro athlete. So just try to go 1 at least or twice. That's more achievable. Find something that you love, maybe something you wanted to learn when you were younger, you never did, because then there is studying, then there is a career, then there are children, and you never did. No, you want to learn play tennis, or you want to learn dancing. Why not? That's really the time. Get something you are passionate about, so you love doing it. Get a friend to do it with you, and you will be looking forward to go to do that kind of exercise. And there is
Yes,
dancing is a wonderful exercising, for instance, or just another sport instead of staying necessarily at the gym if you don't like it.
right.
So trying to find achievable goals
Mhm.
and little steps, little steps.
Yeah, yeah.
But
So the
put
main
those
aim is to
things.
stay active, pretty much.
Yes,
Yeah.
that's the main thing. Stay active, eat well, possibly a Mediterranean diet, and
Mhm.
be social. That's also very important. These are
Mm.
actually the three main things that make you live longer and better.
Okay. Well, you know, COVID came
Socializing
and
is extremely important.
yes, yes. COVID came and I felt like it really put a damper on socializing, and people may have gotten accustomed to being away from other people. Like I think they're now trying to get back into like, socializing and that kind of thing. And it really is important being around people and just enjoying life. So thank you for
So
that.
important.
Yes,
It's important to keep your brain active, but also your mood and to feel the support, to feel the love of your friends, of your family. It's really try not to isolate yourself.
yeah, yeah. Well, my next question then was going to be, I guess, common mistakes that you see people make when trying to balance wellness
I
and a
think we
busy
answered
lifestyle,
that.
but you did answer that. And oh, I wanted to ask, coffee. Is coffee okay? Because you be tired and you're like, I need a cuppa to just like get me through. So you spoke about wine. Tell me about coffee.
Okay.
I'll brace
I
myself.
am, so first of all, I am a little bit biased because I'm Italian, so I love wine, I love coffee. So I will never say absolutely not. I don't say everything with moderation. For instance, in Italy, we love coffee, but we have our coffee in the morning
Mhm.
and maybe after lunch, a little espresso. That's it. We really don't drink coffee anymore
Okay.
after 12. We
Okay.
never have a cappuccino with coffee in the evening. So that's a little bit overdoing, especially if you put cream in the coffee, if you put sugar, then it's an additional toxic element. I
Right.
think there's nothing wrong to have
Mhm.
one coffee in
Okay.
the morning. Yeah, no, every study show actually it's not affecting you negatively. If anything, it can be positive for some.
Mhm.
But yeah, maybe one, you can have two maximum, and you should try to do that in the morning possibly because you don't want the caffeine to affect your sleep as well. The
Right.
sleep, having a good sleep is like paramount. So this is one thing I didn't say with when you asked me about advice. I
Mhm.
talk about the diet, I talk about exercising,
And
starting to
socializing.
have a good sleep hygiene,
Mhm.
and really, really treasure that moment
Right.
is really important.
Right.
If you don't sleep well, you don't live well and your body doesn't have the time to rest and to recover, and you feel tired in the morning,
Yeah.
and fatigue is going to accumulate, and then the cortisol goes up, and then the weight goes up, and the sleep gets worse and worse. So try to avoid screen time just in bed, just
Mhm.
before going to sleep. You can use a Kindle or those special things for reading because there are not really, the lights are done in a way that will not stimulate negatively your brain.
Okay.
But don't get your iPad or your phone in bed. Try to stop, to have kind of ritual before going to bed, whether you have
Mhm.
your herbal tea, whether you read a book, what whatever this is good for you, it's calming, trying to incorporate in your routine.
Right.
Don't go
Right.
straight from work to bed. That's not good neither. You need kind of a break.
Mhm.
Your brain needs to calm down before you actually put your head in the pillow.
Yeah. 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 And I agree with that. Otherwise, you're not gonna get much sleep because my brain just keeps going,
Yeah.
and I have to like, okay, shut up now. Just let's go to sleep. So that kind of winding down part is really, really important.
Really important, even if you just go out and I don't know, watch the sky and have an herbal tea or have a chat with your partner or read a book. And it doesn't need to be a history book, okay? It can be whatever really make you kind of disconnect with
Yeah.
your day, with your routine, and bring you somewhere else that is a little more calming, and then it will accompany you to your night sleep.
Oh, yes. That's great advice. I'm gonna start taking that up as well.
Or some
Because we're
relaxing music as well that might
yes,
help.
because we're so connected to our phones, right? So it's really important to actually disconnect and a good while before we go to sleep. And we know it. So we just need to put it into practice now. Um, how many hours? Because is it 8 hours? Is it like we have to do 8 hours? Is that like the medical standard for you to be rested? Or
Okay, that's ideally, yes.
right,
Ideally, you would like to sleep 8 hours,
mhm,
but it really depends on the quality of the sleep as well.
right.
If you can get at least 6 hours good sleep,
Okay.
that's a good goal.
Okay.
That's an achievement. But yeah, 8 would be great, and obviously
Ew.
depend on your age.
Mhm.
Um, older you are, you might need sleeping less because the metabolism is a little bit slower also. When you are younger, like kids, they need to sleep 12 hours, 13 hours because
Yes.
they are growing,
Yeah.
because they need much more time to recover and to rest. The metabolism is super, super active. So it needs refueling, recharging.
Yes, that's true. That's true. Because I find that I don't do the full 8 hours. Um, but then I still feel rested even if it's like six, maybe seven.
Yeah,
And
it really depends on the quality of the sleep mostly.
right, right. Okay, so let's talk marketing for a second because that is the area that I am in. And so from my experience, especially speaking with other practitioners in the health and wellness space, one of the most frustrating elements is just trying to figure out what to do, where to do it, how to do it, and often, even where to start. And um marketing is a big important thing, right? Especially when you have a business. So can you share maybe strategies of what you do to reach out to this particular age group?
Yeah,
And yeah,
yes,
women in this particular age group.
it's true. And again, this is a field that is changing the healthcare completely. And it's difficult in the healthcare doing marketing because it's like a very thin line. You don't want to advertise. That's not actually not even allowed by the medical council.
Right,
So it's, yeah, you can advertise servicing like aesthetic or the pelvic floor therapy, these kind of things.
right,
But as a doctor, you cannot advertise yourself.
right,
Um, so, but it's important. It's people lives with social media, with Instagram. And nowadays, you look more on Instagram than even Google. So
yeah,
I think it's important that as a healthcare professional, we try to send that message on that platform, but it needs to be done in a very professional way.
right.
So for me, it's all about education.
Hmm.
So
Hmm.
when I do a little video or something, I try to educate people. I try to give information. I try to talk about new articles that come out, new research, or new treatments available, or how to do prevention, what tests to do. And if we look actually at the trend, that's what people really want. These are the messages that are well received, really. They
Okay,
are they are really thirsty for information,
right.
especially about women's health and about menopause. But because there have been years of silence, and because there are lots of women in the same on the same boat, and they
Hmm.
just are looking for help.
Yeah, yeah, yeah. Because like you said, there's that kind of stigma surrounding menopause where you even menstruation on a whole, where you don't talk about it, it's kind of hush hush. And then if you do, it's kind of like this embarrassing thing. But really, it should be something that is celebrated and women should be able to get help. Because I mean, we all have to go through it. It's just something that we're gonna go through. So why not get help and embrace
I
it?
don't know.
And
It's very cultural, like it's something to be ashamed. I remember when I first arrived in Barbados,
hmm
I went to the supermarket and I bought some tampons.
hmm
And the lady and the cashier asked me, "Do you want to put this in a paper bag?"
yes,
Why? I could not understand why. And then I realized that it's like kind of hiding it,
yes,
no?
yes.
Because I don't know why. It's like every
I
single
don't
woman in this world has menstruation
I
and
don't
needs
get it.
tampons. So we need really to be open about that and start
Yeah.
in the house with your children. There is nothing to be ashamed. It's
No.
part of nature.
Yes, I remember when I first started to get my period. Sometimes I would have really bad cramps and like you feel tired at times and that kind of thing. And I remember a family member was saying, you shouldn't let anybody know that you are, that you have your period. You shouldn't be showing any signs or symptoms. I'm like, but I'm tired. And it hurts and I just want to get some rest and that's when I was younger. So as I got older, I'm like, no, if I can't make it out of bed today, then it's gonna be a sick day for me because I need to rest. I need to just, get my energy back. And I'm
I
in
think,
pain. Like,
yeah, and
you know
that's
what I
also
mean?
not normal because you should have some discomfort is okay, but having
Mhm.
a painful menstrual period that you cannot get out of bed, that should not happen. So that's
Okay.
something should be addressed. So this is a
Okay.
very important message, especially for the young women out there. If
Right.
you are in a severe pain, it's not okay. You should not.
Okay.
There is, and probably there are so many solutions for you
hmm
out there that doesn't require you to miss school or to miss work or simply just to be in pain because that's not that's unacceptable.
Okay. Well, glad
I
to hear
think
that too.
yeah, I think it's also it's yes part a little bit cultural being ashamed of the tampons and the bleeding, but it's also women. It's like seen as a weakness, no?
hmm
So we need to work double to show that we can do things, and so we cannot show weakness when you are in pain, when you have your period, when you are pregnant, you keep going, and there is this kind of race to who can do better. And we should start a kind of slow down and actually support us instead of being always on a competition of
Yeah.
who is more resilient because
Agreed. Agreed.
that's that's not a challenge I want to win.
Yeah. I know, right? Okay, I know we're running
out
here.
of
So
time.
two questions. What are the most exciting trends or developments happening in your industry right now that we women can get excited about? What's happening? I've been seeing stuff like non-invasive, like facelift procedures, because like
Oh, you're
not like
talking about
lasers.
aesthetic? Yes. So it's changing so much. First of all, aesthetic world is like every day there is something new. It's
hmm
really difficult to keep up with it. Some things are really good, some less. So also difficult to understand which one are actually worth it or not.
Right.
Uh, I think though the main trend is working on regenerative medicine.
hmm
So using exosomes, staminal cells, skin boosters, all those tricks that basically make your skin, your cells to get younger without doing invasive procedures or
Yes.
without using too many fillers or things like that. Lots of clinic are going on that direction, like us. So it's not really too trendy anymore to do the facelift, major facelift, or having huge lips, etc. So it's
Yeah,
just trying to keep your natural features and work on the natural beauty. I think that's the major trend. So it's a little bit trying to going back instead of going further in terms of visual. But the technology is amazing now. So there
right.
are so many things non-invasive that can actually help you to
Yeah,
regenerate your cells.
yeah, that's amazing. I love it. I love technology and I love anything that's minimally invasive.
Yes, safe first of all, safety first of all,
Um,
and effective, obviously, and hopefully pain-free as much as possible.
all right, so last question for the road. Now, what's the one thing you wish more people knew about health and wellness or your clinic that we haven't covered yet in our conversation?
Okay, so that we do every woman from teenagers to all women. So
Hmm.
from 12 to 90, I think it's our spectrum. So it's not only for midlife women,
Yes.
but
Hmm.
yes, we have a special attention for those women in the early 40s, let's say. So if you don't find someone that can listen, that understand all those changing starting to happen in your body,
Hmm.
this I think is the place where you can find lots of education, lots of tools, and lots of solutions.
Okay, okay, great. Well, thank you, Dr. Corona. It's been awesome
Thank
speaking
you
to
for having
you.
me. I hope this will help some other fellow women out there.
Same, same. Have to get you again because I do want to talk about, is it perimenopause? I do want to
Yes,
have a conversation about that. I do follow a few influencers online who talk about like the symptoms that you can experience before full-on menopause. And I
yes.
find that really interesting. Stuff like where you can't sleep properly, you have brain fog, all these kind of things. So yeah, I want to kind of dive a little bit deeper into that when you have
Yeah,
time
let's do
again.
that.
Yes, but thanks so much. You have an
Bye.
awesome
Have a
day.
wonderful day.
Bye bye.